A stoma is an opening created surgically between an internal passageway and the body's surface. A colostomy is an opening into the colon, while an ileostomy is an opening into the ileum. The stoma, or ostomy, is created by bringing a loop of intestine to the skin to allow feces to drain through it. This type of fecal diversion can be permanent or temporary. The stoma is typically created from the most distal point of non-diseased bowel possible to allow for maximum absorption of food, fluids, and electrolytes, and to minimize fecal incontinence. When you care for a client who has a stoma, you will focus on good stoma and skin care, feces collection without leakage, odor control, and prevention of complications such as infection, constipation, fluid and electrolyte imbalances, and stoma prolapse or retraction. Fecal material is very irritating to the skin, and the more proximal the stoma in the bowel, the more irritating the feces will be. Prevention is your best strategy, using frequent, gentle washing and thorough drying of the peristomal skin. Using a barrier at the stoma is a good way to keep fecal material from coming in contact with the skin. The proper application of the barrier and the appliance or collection bag is also essential for keeping the peristomal area free of irritation and to control odor. Temporary pouches are made of clear plastic with an adhesive application area that already has an opening in it to accommodate the stoma, or a hole can be custom fit to the stoma when the pouch is applied. Permanent pouches are made of a variety of materials and have a solid faceplate that fits around the stoma. Some pouches come with charcoal filters to help control odor, or deodorizers can be added to the pouch. These disposable appliances can be left in place up to a week and are designed to be emptied from the bottom of the pouch when half full. If feces leak onto the peristomal skin, the appliance should be removed and good skin care given to the peristomal area before applying a new appliance. If irritation persists at the stoma or on the surrounding skin, the appliance should be replaced every 24 to 48 hours. Good skin care and any prescribed treatments are priorities until the irritation subsides. While changing an ostomy appliance and providing stoma care, you will assess the color of the stoma, any bleeding from the stoma, any redness of the peristomal skin that is not from removal of the appliance or from the adhesive, the amount and characteristics of the fecal material draining from the stoma, and any burning or pain in the abdomen or at the stoma. You'll document your findings in the client's record and report anything unusual or abnormal to the provider. Now let's go ahead and demonstrate replacing an ostomy appliance and giving stoma care. We'll assume the nurse has checked the provider's orders for the type and size of the appliance and any barrier substance to use, explain the procedure to the client, and review the institution's protocols for this procedure, as well as the manufacturer's instructions for using the supplies. If the client is ambulatory, it is best to change the appliance in the bathroom to reduce embarrassment and to help prepare the client for managing the ostomy at home. It is also easier to do with the client standing. First, the nurse assembles her equipment. She will need the appropriate appliance or pouch, the prescribed skin barrier, paste, powder, water, or liquid skin, a stoma measuring guide, a pouch clip or other closure device, the appropriate adhesive if required, clean gloves, soap and washcloths, warm water, scissors, a bag for disposal of the used pouch, a pan if working at the bedside, and any prescribed deodorizer. The nurse positions the client optimally, then washes her hands and puts on the gloves. She empties the soiled pouch, then gently removes it by pressing on the skin while pulling on the pouch. Then she places the soiled pouch in the disposal bag. Next, she cleans the peristomal skin with soap and warm water or according to the provider's orders or the institution's protocols. She uses the scissors to remove any excess hair in the peristomal area, then dries the peristomal skin gently but thoroughly, assessing it and the stoma carefully. She checks the pouch opening for a proper fit around the stoma. Next, the nurse applies the prescribed barrier or paste, then gently presses the new pouch in place, fitting the opening carefully over the stoma. She adds deodorant to the pouch as prescribed, and then applies the appliance closure device. After replacing the ostomy appliance, you'll remove your gloves and dispose of them and any other materials in the proper receptacle. Make sure the client is comfortable, then wash your hands. Document the condition of the stoma and the peristomal skin, the skin and the stoma care you provided, the appliance change, how the client tolerated the procedure, and any other concerns or observations in the client's record.